Hello and welcome to today's review. Today we are looking at the difference between a sprain and a strain. So to start us off, we have a question. The nurse is caring for a client who has been diagnosed with a strained ankle. The client asks the nurse what's the difference between a sprain and a strain. How should the nurse respond? A strain is a milder form of injury compared to a sprain. Sprains involve injury to the ligaments, whereas strains to the tendons or muscles. Sprains are the results of repetitive use, while strains are from acute injury. And lastly, in as D, a strain involves stretching of the tendons, while a sprain involves tearing of the tendons. So well guys, we have around 10 differences between a strain and a sprain. Okay, and the easiest way to remember is that the strain is involved with the tendons. That the tendons affected, whereas the sprain are the ligaments. Okay, so in terms of affected tissue, the strain affects muscles or tendons, whereas the sprain affects the ligaments. In terms of causes, strains cause overstretching or tearing of muscle fibers, whereas the sprain results from overstretching or tearing of the ligaments. Strains are common in muscles around joints, while the sprains are common in joints, especially the ones at the ankle or the wrist. We have pain, muscle weakness, and spasms for strains. And in terms of symptomatology, the sprain presents with pain, swelling, bruising, and limited joint motion. Strain can be categorized in grade 1, 2, or 3, whereas the sprain can be categorized also as 1, 2, or 3. So ladies and gentlemen, this is a similarity. In terms of severity, strain, they are less severe compared to sprain. The sprain generally are considered more severe than the strains. In terms of treatment, the strains, we can have the rest, ice, compression, and elevation. We use rice to treat the strain. But for the sprain, which are more severe, we shall need rice together with immobilization and physical therapy. In terms of recovery time, strains generally we have shorter recovery time, whereas the sprain recovery may be longer. Risk factors, we could have sudden forceful movements, improper technique for the strain, whereas the ligaments will have falls, twisting spots, and injuries. Remember, the most affected ligament, for example, in sports football, you have the ACL, anterior cruciate ligament, yeah, at the knee. Correct, guys. This one takes more time. 6 months? Yes. So, in terms of prevention, we normally say for you to avoid the strains, we have warm-up exercise and proper technique, okay? But for the sprain, we have the strengthening and flexibility exercise will help prevent the exercises. Okay, so those are the 10 differences between a strain affecting the tendons or muscles and a sprain affecting the ligament. Remember, all of them are connective tissue components. So our question was to differentiate between a strain and a sprain. Can we get the correct answer, guys? A strain is a milder form of injury compared to a sprain. Yeah. Yeah, this can be kept for consideration. Sprains involve injury to the ligaments, while strains to the tendons or muscles. Yes, this is what we said in terms of affected area, affected tissue, muscle or tendon or ligament. Okay, the other one we are talking of terms of severe. We are saying that strain, they are less severe compared to sprain. Okay. Yes. Okay. Next we have sprain. So we have A and B kept for consideration. Sprains are result of repetitive use while strains are from an acute injury. Guys, what did we say that? The cause? Yeah? The risk factors. Strain, we say that the sudden forceful movements, improper technique, whereas this one you have falls, twisting, spot injuries and accident. Okay, so this one you find that it might not be correct, guys, because all of them happen to be in an emergency, almost all of them, the two. Okay, so this one can easily be eliminated. The last one, a strain involves stretching of the tendons, T, tendons, while a sprain involves tearing of the tendons. Okay, guys, we say this one, this T for the tendons or muscles, and the sprain for ligaments. Okay, so this second part of this answer for D makes it wrong. So that's why we can confidently eliminate C and D. So we go back to our A and B. A strain is a milder form of injury compared to sprain, and sprains involve injury to the ligaments and strains to the tendons or muscles. So guys, we all of us have to pick the most appropriate one to be as B because it's more complete and more inclusive answer. Okay? So if you look at it, you say that in terms of the affected tissue, this one, the T affects the muscle or tendons as compared to the sprain that only affects the ligaments. In terms of severity, it's less severe compared to sprain, generally considered more severe than strain. Okay, but this one is more affected, more of the difference, okay, because it's the one that shows as the affected part. Okay, so there it makes the severity may vary, okay, depending to the degree of which the sprain is. Yeah, supposing you have a grade 3 strain compared to grade 1 strain. Yeah, in that case the severity may not hold off, but this one is constant, guys. Affected tissue, it will always be the muscle or tendon or the ligament, and that's why we have gone for that B. Okay, so ankle strains result from muscle or tendon damage, while sprains are result of ligament injury. Both can range from minor to severe and have equal levels of pain. Bruising and swelling in the joint is more common with the sprains, while strains may show signs of inflammation and muscle cramping more commonly. So strains can be acute or chronic, while sprains are associated with acute injury such as rolling over the ankle. So guys, those are the 10 differences between a sprain and a strain. Thank you so much, and remember to take the free quiz that is found in the description section of this video.